Welcome everyone for today's session. Today we'll have a discussion on psychological first aid. Myself, Dr. Rakesh Chandar, and I'll be taking this session today. So, what will be the learning objectives for today? Today we will be focusing on the session as two parts. The first part will be of understanding what are the basics of psychological mechanisms when somebody goes through distress. And the second part will be about the psychological first aid proper. What are the principles, goals, and definitions, and what procedure that you need to do as a lay counselor. So, for first, going on to the basics of psychological mechanisms. So, when I say basics of psychological mechanism, it means when a person goes under a distress, right? You tend to go through certain mechanisms in your brain which will help you to come out of it, to fight through it, right? So to begin with, there are certain causes which causes this distress. So once only you know the causes, you will be able to fight the distress better. So when a client comes to you, there are certain indications for which they come to you. Usually they come because they have some problems at work, or they quarrel or fight with their family members, or certain personal reasons in other domains, in social domains, like with friendship or with colleagues. They could have certain problems and they'll end up having with you. So basically, it is basically these three major domains, either at job or relationship or family, where in job there could be poor job skills leading on to not able to hang on to the job or not able to perform better, so thereby leading to unemployment that could lead to problems or difficulty in managing work itself. So when I want to put it in terms of children or adolescents, there could be problems at their school or college. They will have difficulty in getting along with their peers or colleagues or friends. They could have poor interpersonal skills or multitasking skills at work, or with personal and professional life. So they could land up having poor outcomes at their workplace or college or school. Relationship or interpersonal skills in terms of not able to manage emotional things between a couple. It could be romance, or it could be even in terms of friendship. It could be getting into trouble because of a lot of attachment issues, a lot of too much clinging or clingy behaviors. All those not being assertive, all those things could lead to conflicts between either romantic relationship, or it could be friendship also, uh, or even colleagues for that matter, professional relationship, leading on to conflicts. In family, poor multitasking skills in terms of, as I already told, could be either aging parents at home, or to take care of them, children at home, taking care of them as well, and at work. So not able to do things, getting into a lot of newer responsibilities, as new stages of life. As you enter new stages of life, you will need to have a different life skill set altogether. So not able to uh, you know uh, cultivate those kind of newer skill sets can lead to problems, thereby leading on to having distress or conflicts. So these are the few common problems in which they come. That could be because they can come saying that I have issues with my wife, I have issues with my anger, I have issues in falling asleep, I have headache problems. So it can manifest in different ways and they come to you. So what are the basics of psychological mechanisms? We need to know certain terms and definitions before we actually say what exactly happens. So for that, a little brainstorming activity that we will try to do. So I'll be showing you a picture, and I'll be asking you to think about uh, that picture in the coming terms. So this is the picture that is going to come. So what do you feel when you see this picture, right? Take a minute or so and think about how do you feel, what do you think about when what all things come to your mind. It could be an image, it could be a picture, it could be a movie, it could be some of your own previous experience of getting into a hang of this memory. If you see this picture, what do you get in your mind? So I'll tell you my perspective of what I experience. So when I see this picture, I feel that it's gonna rain, and somewhere I have a memory of being in this atmosphere earlier, where I used to, feel like, sitting inside and taking something hot like a coffee or a tea, and then, just lying on the bed or watching some movie where I remember watching some, English movie where it has similar kind of pictures. So I would go back and try to look on it and feel good about it, right? And maybe I will try to go out and have some, drench in the rain, and all those things would come to my mind, isn't it? So there is a feeling of goodness, right? And there is with that feeling there is an emotion of happiness where I feel like doing something happy. So that is the emotion that I have, emotion of feeling happy, right? And then that is lasting for some time, so that emotion pulls me to do something behaviorally, that I will have to drink coffee or watch a movie or go out and drench in the rain. So when you have a feeling, there is an emotion or a memory attached to it. It could be either positive or negative, and then you do certain behavior to keep enhancing that mood, so that you will be able to sustain that mood for some time, so that you can enjoy that, particular mood, and you go through for some time, and then once probably the atmosphere waves away and becomes normal or sunny, then the mood changes, isn't it? This is a positive way of seeing it. Few of them might have negative experiences. Few of them might have felt that, somebody would have had an experience of, lightning, and there's a storm coming, and there could be negative experiences in terms of light going off at night, and they're not able to, and there's a lot of scariness around. So they would feel agitated. So what they would have done is probably they felt scared about it. There are a lot of bad memories coming to their mind. They might try to feel go and locked in a locked in state, where they just go inside a blanket, and try to sleep off or not see anything out, not try to do anything, right? There's again a feeling of sadness or scariness, followed by which there's a behavior of isolating themselves and not feeling enjoyed, rather feeling scared and going and lying down. So that is the behavioral component of it, right? Why I'm telling this is because for any kind of an activity, for example, I've already told, if any distress comes or a problem comes to you, the three domains in which your body or your brain will react in terms of, so once there is a feeling or an emotion attached, there is a thought process roaming around, which could be either positive or negative. And according to the thought process, you will start behaving with certain actions, right? So what is feeling? So first we will see a few definitions. There's a few theoretical aspects that you need to know. So the definition of feeling is that it is a reaction to an experience or an event. So say, for example, once I show the picture, there's a reaction to you saying that feeling good or bad about it. So it could be either positive or negative. So you're feeling happy once you saw the picture, or feeling sad because of that. So if you see the picture on the right, the feeling is a smaller one, and the emotion becomes a bigger part of the feeling. So it's a stirred up state following the feeling that you had, with more of physical changes in your body. You might start having, so once you feel happy, you might feel more joyous in your body. You feel energetic, wanting to do something. Your your body, if would have been very lethargic, might become more active. You will feel your heart pumping faster. You want to do something nice for yourself. Or if it is on the negative aspect, you will start feeling scary. Your heart will start pumping, but more scarier manner. So it will start pumping more faster, and you might have shivering. So also more stirred up state of a feeling, with physical changes in the body, which the event might either abolish or maintain the feeling that you have had. That's what I told. So your body will eventually want that feeling to be there for some time. That being there for some more time is the emotional part of it, right? So even when you're feeling scared, it won't go immediately. It will be there for some time. It's not only being happy. Even if you're sad, it'll be there for some time. That is the emotional aspect of it. Then mood is the more extended part of emotion. So because of this feeling of having, starting with a rainy day, if it would have been seen on a positive aspect, even if it becomes sunny in the evening, you might feel that, since it was very pleasant in the morning, the whole day will be colored with a happy mood. So you will feel that as if the whole day, even if in the evening it is sunny, you will might feel more completely energetic because the mood is already set in the morning, isn't it? So it's a more pervasive and sustained phase of that emotion through which you start perceiving the whole world. So whatever happens that day, you might feel, even if something bad happens, you'll be feeling like, okay, it's fine. So what? I'll be able to tackle it better. So once you're happy, you're able to tackle it. On the other side, it's negative. If you're feeling negatively charged, emotionally charged because of something happened in the morning, and even if evening things become pleasant, because the mood is already set and it's become more sustained because of the emotional things happened already. Even if a good thing happens, you might feel irritated again, so even you won't be able to acknowledge the good things happening. So the mood is already set. So the once the mood is set, it's more of a pervasive thing. So if you see the next graph that I'm going to show you, so once there is an event or thing that has happened, right, if there are going to be stirring up of the feelings every now and then with different emotions. Say for example, I'll give another example in terms of, say if your boss has scolded you and you're feeling that has happened in the morning, and you've been thinking about it again and again with bouts every now and then, and there is no good emotions happening in between. So if you see every now and then the small bad emotions happening, and your mood is set as if the whole phase, say a particular duration, is completely colored in a very negative mood. So whatever happens during that time seems to be negative at all the time. So it's completely colored. Whatever even good thing happens, you won't be able to perceive it in a good manner. You will be completely seeing it. So if you see the definition, it's again, it's like you start perceiving the whole world through that mood that you have already set. So when a good thing happens, you start seeing it negatively. So that's what mood, emotion, and feeling is all about. So if once you start having such mood, right? If you see this graph, it shows that every emotion has its own way, its own intensity, isn't it? So if you see the next slide, each intensity can have a different way of reacting. So each person will have a different way of reacting to this emotional aspect. So as I told you, once you have a feeling, you have a thought process, and then you act to that thought process. So this range of emotional reaction is the action secondary to the emotion that you have had. So there is a range of emotional reactions that have been identified. The first would be a normal emotional reaction, and this normal emotional reaction is nothing but, let me tell you what all things first, and then I'll explain one by one. So the next one will be abnormal emotional reaction, then abnormal expression of emotions, and then morbid expression of emotions. Let me take an example of an exam stress. Right. If you see the first picture, a child is preparing for his or her exam. Right. So for any person to thrive well in an exam, you need to have certain amount of anxiety, isn't it? So that it pushes you to read, it pushes you, motivates you to keep reading properly so that you pass the exam, right? There is a normal emotional reaction that you have at, oh, there is an exam, I need to read for it, probably I should not engage in any recreational activity like going and playing sports or watching TV, so I need to cut it out. So I need to focus on this. So some kind of anxiety will push you not to do pleasant things and then focus on particular task in hand. So that is a normal emotional anxiety in this exam case that you have. The next thing is an abnormal emotional reaction where the child gets too overwhelmed with the pressure in terms of preparing for an exam. We have definitely seen children at our own homes or in your neighborhood that few children will become too restless when an exam comes. They get too anxious about it. They start thinking about the outcome, whether I'll pass or not, how it's going to be, whether the question that will be easy or not. So they start panicking too much, and they won't be able to concentrate on the task in hand, that is to prepare for the exams. They start not sleeping properly. They become too anxious about it, and they don't read, and thereby they end up having problems in the exam results. So the that is more of a next level of emotional reaction. The other level, the next level would be of abnormal expression of emotion. That means having certain physical symptoms secondary to the abnormal emotions. So it would be like, say for example, few children will start telling that they are having fever, they're having stomach ache, during the exam times, which we sometimes name it as exam fever, they start becoming absent for exams because of that, so that the brain subconsciously says, I'm not able to handle it, so I'm going to tell the other systems to also shut down. So subconsciously the brain makes the child believe that they are not feeling well, and so only they are not able to prepare for the exams. And that's a very good excuse for you to not write the exams, acceptable, socially acceptable excuse. So the brain is brilliant enough to say that. So that is an abnormal expression of your emotions. But actually what has happened is your psychological mechanisms are actually weak and repaired, and that's why there are physical symptoms. So there is abnormal expression of emotions. The last one would be a morbid expression of emotions, where you can see there is a mental illness or a disorder because of that. Say, for example, if it is becoming too overwhelming for the child or any person of that sort, whether a college student or any work activity that is too overwhelming, that they're not able to do it at a point in time. So leading on to having depression or feeling, say, for example, I can give you certain symptoms that can happen. The child is feeling too stressed of exams. They may start hearing voices of the teacher telling that you're not reading properly, even when the teacher is not around. It'll think as if it's so real that they are able to hear the teacher coming, around and telling it, and they may start being suspicious that the teacher is trying to set very tough paper, and because of that, he or she, the child, strongly believes that the teacher is against him or her, so that they don't want to pass the exam. So they go to school and start picking fights with the teacher, thinking that this is happening. So these are all morbid expression of emotions, which we call it as, it could be hallucinations, delusions, right? Or the otherwise is like feeling very depressed, not able to, completely anxious about, or sad, so that they completely start crying, not doing anything, not sleeping, not eating properly. All those things are morbid expression of emotions, which could lead on to having a psychotic breakdown or a depression, anxiety kind of a mental illness. Right. For a lay counselor, we are going to focus only on abnormal emotional reactions, or maybe some milder forms of abnormal expression of emotions, which we are expecting a lay counselor to focus on. Right. These are the usual cases that come to you, especially the abnormal emotional reaction. So, right. So, if you see what all the factors that determine the abnormal expression of emotions or abnormal emotional reactions. As I already told you, few children in your family or your neighborhood will have this, few children might not have. So what is the differentiating factors? The differentiating factors would be the personality or the temperament or the character of the child, in which, when the character I say, it depends upon the way they have been born and brought up. When I say the way they have been born, it means some biological factors like normal delivery, or whether they had any cesarean section, whether they had any problems as a child in terms of whether they had any seizures or any ICU admission, did not cry immediately after birth, some developmental delay in terms of walking, speaking. Those are the factors which are involved in biological factors in terms of the character of the child, in terms of so that their immune system are properly psychological immune systems, I would say, so that the properly grown, and the way they are brought up as parents, what kind of an atmosphere that you give for the child to grow up. It could be either the internal environment as a family or the external environment as a neighborhood as well. So what kind of peers they are being exposed to, what kind of uh, what way in which they are parented. For example, a child who was being had a normal delivery and no problems in growth, physical growth, and in terms of environment and parenting, no it's been given proper attachment and love, with proper teaching in terms of life skills, and told what is good and bad and all those things, can handle two or three exams even in a day. Say, for example, in once you go to fifth or sixth standard, you will have two exams, morning and evening session. So even if that is the case, they could be able to handle the situation properly. Whereas on the other aspect, the child who's had some problems in birth, or not even no problems at birth also, but when it's been born and brought up in a very punitive parenting, very strict parents trying to be very over involved in terms of not showing them what good or bad is, not showing them what stress is all about, not showing them, always showing them love, and not showing them what a problem will be like. And immediately they have to go into a situation where they have to handle 2 or 3 exams at the same time, that too over years, fifth standard, sixth standard. So there is a threshold for every child in that matter. So suddenly at some point in time they break down and they start having what we see it as abnormal emotional reactions, right? So you need to check into the character, the intensity of the situation in which the child has come, and the longevity of the situation. When I say longevity, it means how long they've been exposed to these kind of situations, right? What is the duration, right? So all these things would determine whether the child or the person will have a normal emotional reaction or an abnormal emotional reaction or an abnormal expression of emotions, right? Right. So how do they present to you? So when they present to you, all these things, the previous things that I've told you, it's all theory aspects, right? Now we go on to the practical aspect of it. So when they come to you, they are either anxious or they are depressed, right? When they're anxious, you take the same example of exams, they will start having uncertainty about future, whether I will pass this exam. Fear, they will panic, they will have, so they will lose their calmness. So this is the feeling that they are going to have. Okay, I've broken down again it into feelings, thoughts, and behavior. So the feelings would be about, if they're anxious, that means they're uncertain about the future and they're lost their calmness. That's their feeling. When they're depressed, they are feeling sad all the time. That means, so if you're anxious, it's more of an excited state, so they are restless, they're not able to sit in one place. Whereas when they're depressed, they are sad, they become more lethargic, there is no activity level at all, there's low in confidence, low self-esteem, feeling that they have not been helped or supported. So there's no change in the fate or the futures. Is that what they feel, right? So the thought process would be, when they're anxious, they won't be able to focus on the task in hand. And so they have thoughts of not fear or thought that they won't be able to finish their task. So they get more anxious and less calmer. And whether anything bad will happen. For elderly, it will be about whether they will land up having, unemployment and thereby financial issues, or they will, by thinking they might have stress induced problems, like they can land up having diabetes, hypertension, thyroid problems, or something like that. So those kind of thoughts they could have. um, Whereas for in depression, they will feel like there is, nobody to help, whom to share this thing. Whether if I tell my parents, whether they will scold me, whether I tell my peers, whether they will bully me, those kind of thoughts they will have. So they will start feeling that they are lost their capacity. So they feel that they are unworthy, and it was all fine, and now everything is gone against me, so the world is unfair. Those kind of thoughts will come, and they will start having suicidal thoughts, that it's better to die, right? And the action and behavior secondary to those thoughts will be like, they will feel anxious in terms of, as I already mentioned, they will feel irritable at times, they will feel not able to concentrate on their activities, won't be able to have memory problems, in terms of, since they're anxious, they won't be even register what you're telling. So that at the end of the day, they won't be able to recall what you have told also. And they will start having physiological symptoms, as I already told you. They will start feeling shivering, tremulousness, lightheadedness, right? Some, I told you, exam fever and all those things they can have. Because of that, disturbed sleep as well. So the body will react to your psychological mechanisms in these ways. And in depression, the opposite will happen. They will completely shut down, they will stop talking to people, they will feel tired all the time, they won't be able to, they will feel amotivated because, or disinterested. Because of that, they won't concentrate at work and they won't do any activities. They will start feeling like lying down all the time, and they won't take food, and they won't, because of these mechanisms, they won't sleep properly also, and they will have suicidal thoughts or attempts, right? These are the ways in which people can present to you. Mostly it will be coming and saying that, they have had a headache, or the physiological symptoms would be headache is the most common presentation, not feeling sleepy, having quarrels with, getting irritable and having quarrels with family members all the time. And with children, they will say that the child is taking leave all the time, not feeling dull all the time, crying most of the time, and not talking to others, not eating. So these are the few presenting complaints that will come to you, right? So once that comes, now that you have understood that why people feel distressed, and what and feeling an emotion or a behavior secondary to an emotion is all about, and what kind of emotions it could be, right? uh, we will now go on to what we call it as psychological first aid. So when I say psychological first aid, this is the first thing that you would do when a client comes to you. And here I will not be focusing on what are the suggestions, practical suggestions that you could give. Psychological first aid is actually knowing about the problem in detail, seeing how about the quality or the content of the problem and how bad it is, about the quantity of the problem, how magnitude of the problem. And in that process itself, listening to them and trying to use your psychological counseling skills to talk back, paraphrase and rephrase and summarize itself, there is a feeling of being understood. As I told you before, that the feeling of there is nobody to help, there is the world is unfair, and those kind of thoughts that they come with. If you start listening to them and if you start honestly responding to them by reflecting and paraphrasing and summarizing, that itself will be therapeutic for them. So the process of assessment and understanding itself is therapeutic, and that is what we call it as psychological first aid. Feeling of being understood by someone other than themselves, and there is somebody to genuinely hear without judgment. That I know that I am there's somebody to listen, and I am there, kind of a thing. So that is what a psychological first aid is all about. And the next step will be about what suggestions you can give to come out of this distress will be discussed in a different session, that is stress management, right? So what are the principles? So to now we'll be focusing on the, again, theory aspects. What are the principles of a psychological first aid, and what are the goals that you need to attain, and in order to maintain those, to fulfill those goals, how you have to tailor make the whole assessment process is what we will be discussing in the next few minutes. So the basic theory behind counseling, any counseling, is that everyone as an individual has the tendency to move forward in their life and to grow and reach their fullest potential, right? And their fullest potential means it's very subjective. It doesn't mean that everybody will become will get the first rank, or everybody will get reach the top. According to the ability that each person has, they will reach to their full extent and not an objective. So ranking is objective, whereas this fullest potential is subjective enough. So I have this much capacity and I will be able to do this. So every person has that particular capacity without comparison, and it will be hindered by negative and unhealthy attitudes about self. This could be either from the individual thinking that he is unworthy, or, as I told you, objectively the world is saying or giving a perception that he is unworthy. It could be because of their parents doing it, or their neighborhood causing such a kind of an attitude, and the person is feeling unworthy. So the principle of the approach should be that living in here and now situation and current perceptions are more important than the past, not thinking about what has happened in the past and what will happen in the future, and not comparing things with other people, and not and saying that each individual is unique, and this is not a race, and we are trying to explore your own capacity that you have to fulfill in your own life, and not thinking about other factors. So providing those kind of inner discussions in a very supportive environment with warmth, genuineness and understanding is what a client, a therapist or a counselor need to give to this particular client, right? So that is the principle of the approach. So in that way, with that principle, what all goals that you need to reach? So the goals will be to provide, as this is more of a summary of the first few sessions that we have already focused. So providing a space to experience and express their feelings, right? What all distress they have gone through in a very secure space, and thereby in that process, at the end of once you have express their feelings, increasing their self-esteem and telling not to compare yourself with others, and being openness to experience that it's okay to be yourself. And this life is not a race, and we're not going to reach any goal that other people have set. You need to set goals for yourself, and if it is going to be anything that you need to do in your life, right? And reduce, and in the same time, to reduce defenses, guilt, and insecurities. When I say reduce defensiveness, it's like each person will have his own ways of being in his own comfort zone. So when a person says, I have so and so goals in life, somewhere they don't want to achieve that as well, because somewhere they will be in a comfort space already. So they don't want to go to the next level. At the same time, I mean, they want to go to the next level. At the same time, they don't want to improve themselves to have such skills. Say, for example, if a person wants a promotion in his office, there are certain things that the company would expect him, certain skills or certain targets that he need to achieve. But he, as a person or a character, seems to be very lethargic, not proactive. Wants to still get promotion, but wants to be the same, lethargic person. But still, if he wants to get the promotion, that is not going to happen. So breaking those defenses, asking him and confronting him that you are telling that you need to go to the next step, but you aren't doing it. So how do you want to improve yourself? So doing that also, not so initially you provide them a very secure space, so to gain the trust and confidentiality, and then being more confrontative is also important, so that you reduce their defenses and saying them and make them realize and understand that they have some deficits, and only because of that they get into such conflicts. So do you want to work on that, right? And there's no point in feeling guilty about not understanding this before. It's okay to feel that way. There are a lot of normalizing the situation also. There are a lot of people who are like that, but it's very important that you have realized it now and you need to work on it. So working on the insecurities and the guilt and reducing the defensiveness will be the next goal, third goal, or one of the goals, right? And in that process, increasing the self-esteem and openness to experience or experiment, right? Newer things, to gain the skills, newer skills that, or the deficits that they have lost, uh, or the older skills which were there, they have forgotten about it. So emphasizing those things, and thereby helping the clients to lead a full lives of self-understanding in their own subjective manner, and not comparing with anyone else, so that they have a more positive and comfortable relationship with others. In a single term, making peace with themselves and finding peace with themselves, so that they won't get into conflicts with other people, right? Or situations. That is what would be the goal of counseling. So the definition of the process is what is meant by the definition here. So the definition of the approach would be like, as I already mentioned, these are already mentioned in the previous session. So an approach requires a clients to take the active role, right? So uh, the therapist will just be a facilitator, and he becomes a non-directive supportive person, so that the client only will determine the course and direction of treatment, what he wants, and what he where and when he wants the in what course of time that he would want to pace his own improvement in terms of getting specific skills, right? And the therapist just clarifies the client's responses to promoting the self-understanding. So in the process, okay, you want to do this, you want to improve that, how do you want to do it? Okay, so with the way of your counseling skills, you will be able to meet the goals of the counseling, right? So this is something called as a client-centered approach, right? All the focus is only on the client, right? And the client is the sole responsibility for his life, and he's will be doing such things, and we will just be a facilitator, right? These are all few mellowed down theories that we have got them from different schools of psychology. So this would be apt for a person who comes for help. uh, in this will be the newer way of approaching problems, rather than doing a suggestion or a advice kind of a thing. Of course, there are few clients who come to you with seeking direct suggestions, which also we'll be focusing. But today we'll be telling you the process of psychological first aid, which I already told. It's only going to be a listening process on how you start that procedure. And the later part of giving suggestions as a directive manner will be dealt in a different video. Right. So now we will go to the 5-step process that we have in psychological first aid. Right. So the first step will be to set the agenda setting the stage for the interview. right? So once the client comes in, right, you greet them with their name so that they feel comfortable. Like, somebody calling your name will put you a lot of put the other person on a lot of ease, right? Then introduce yourself and identify your specific role. Tell yourself that you are a lay counselor and you have been trained in so and so thing, and you have been experienced in so and so, and you will be attending them today. So you just briefly tell who you are in probably one or two sentences, a small phrase, and ensure that the client is ready for discussing their problems. Just shall we start with the session, right? And then in the meantime, you would have also removed barriers of communication, which also we have already discussed, like making sure that the room is secure, right? And nobody will come in and barge in when the session is going to happen, so that confidentiality is not breached, right? Your phones are switched off or in silent mode, and there is no other noises that is will be disturbing in between, like alarms or something like that, uh, right? All those things, we will make sure that noise pollution is not there and there is no interference in terms of people as well, right? And say that whatever you ensure comfort and put the client at ease, means that whatever you discuss will be within both of us, or if at all is there, this is going to be a supervised session or there's going to be any academic discussion for the betterment of the client. These data that we are taking or information that we're taking from you will be discussed in a secure manner, again only for academic purpose, with your supervisors or your juniors, for only academic and not in a publishing manner, right? So those things you will tell and set the stage for the interview. That will be the first step that you do, right? The second step is that you will indicate the time, saying that this is a 1 hour or 45 minute session that you will have, right? And you will do, like, you will start with understanding for what reasons that you have come for. So that is setting the agenda. So you set the agenda saying that first we will find out for what reasons you have come. Then we will have a brief assessment about it, and then we will summarize what we have done today, and then we will wind up the session in 45 minutes to 1 hour. And if you have any other needs as a counselor, you will tell that you have to tell them that this is a professional activity and it will not go beyond a particular stipulated time, and we have other patients waiting as well in this thing, so we will have to wind up no matter what within 45 minutes to 1 hour. So kindly bear with the time, and any interruptions that I would do while we're winding up is only because for professional reasons and not because of any thing that I have to cut you down or all those things. You just indicate your needs, right? And then ask them about their specifics for introduce them. They will introduce themselves and they will tell for what reasons they have come, right? They will tell specific symptoms, right? And that time you should once if they have told the specific complaints, you should also tell what is. They will definitely have certain requests. They will say that I need treatment for anger management, I need to reduce my anger, I need to improve my mood, I need to improve my routine. So those will be the requests that they have. Then you also clarify their expectations and understanding. See, I have told you that I have lay counselor. What kind of help do you expect from me? So what is your understanding about this whole process of counseling or therapy? So find out what they are, what is their expectation, and tell what you will be doing as well, right? Say for example, clients may say that I have come here seeking that help, that I would be able to manage my anger with some techniques that you will teach me, right? Or you will give me some suggestions like yoga or something, you will teach me that, so that I'll be able to reduce my anger or improve my routine. So once they've told that, and then they will say that that is what I understand by counseling is all about. So you will have to tell them back that okay, this is what we will do. First we will do an assessment and see why this, where is this anger and this problem is coming from. And then we will find out, then what I would do is I will try to brainstorm with you what problems, how those problems can be, you know because the anger part could be just the tip of the iceberg. There could be some other problems that is leading to anger. So probably we need to find out if there are any skills that are having an impact on this anger. So if you're willing to work on it, we'll work on that. Or else if you feel that you need some ready suggestions, then I will be able to give you some ready tips without going through that phase of brainstorming. We'll directly go to certain suggestions. So this is what I would be doing. So you just give the brief of what you are and what you would be doing, so that there is no surprise in the upcoming sessions. They will feel like, oh, I thought this will happen in a different way. So being very clear and on the same page from day one is very important, so that the trust, confidentiality, and the adherence to therapy will maintain from the beginning, right? So once you set the agenda, you elicit the chief concerns of why they've come, right? And then you summarize and finalize the agenda. So this is what you've come for, is what I have understood. If there are too many agendas, I think you have to negotiate specifics, right? And say that today we'll be focusing on the assessment part, or today we'll be if it's the second or third session, mind you, each session can have its own agenda. There could be new things that would have come, so you might have to say that today I think we'll focus on this, and we will see how it probably many things will be interlinked as well. So we will focus on particular things today, and then we'll see whether time term permits, we'll go to the other things. Otherwise we will focus on this only today. So all those things you will finalize and then go ahead with the session, right? So this is eliciting chief concern and setting the agenda. So it will be the next step, right? Let me give you a case vignette. So after doing all these things, you come to know about this client opens up saying that, she's so and so, Mrs. Lakshmi is a 30-year-old married woman. She has concerns of getting angry frequently since few months, and their family members have been worried about her behavior. So she has come to you seeking help to control her anger. And how do you proceed? So what information do you want to get further? Is what So this is what she has told about her, and you have set the agenda and everything is right. So what you need to do is help the client to express more now. So you start with open-ended questions. You try to expand the things, information that she has told, right? So use certain open-ended questions. What open-ended questions? I think you need to start brainstorming it right now, and we'll be discussing it in the next slide. Using non-focusing open-ended questions, and also obtaining additional information through the non-verbal communication as well. In what way they're telling, in what tone they're saying it, everything matters, right? And then with each part that they are telling, if you feel it's very important, if there is an emotional story behind it, you have to pick those ins that is given by the client, and then you start expanding the story on those lines, right? And if there are any physical symptoms, like most of them will say they have headaches, they have sleep problems, they're not able to concentrate, they get irritable. So all those things are very important signs which says that the problem is difficult for them to handle. So there's an immediate need of intervention. So for each problem or thing that you feel that it needs to be explored, you have to expand the story for each, and you have to repeat the same cycle with open-ended questions and on focusing open-ended skills to know it better, right? For in this case, if you go back to the case vignette again, she says she's a married woman. She's getting angry frequently since few months, and their family members have been worried. So it's more or less a very focused space where she has a problem is what we see from this part. But whether you need to see whether this anger is only related to the family members or to other people as well. So what all questions would you ask here in terms of eliciting the emotional story? So she said she's a married woman, right? And she gets angry frequently, known by the family members. So what would you do? So you ask further questions in terms of knowing about her marriage and about the anger per se, right? So you will find out the anger in terms of when did the anger start, right? When did it start? It start since how long it's been there? How did it start? Whether it started gradually or it started immediately after certain things happened, or it built up over weeks or months, and how long it's been there, right? And if it's been there for long, then what's been the course, like whether it's been happening every now and then because of some problems, or it's always been there on a daily basis, right? Why these are important? Because it gives you certain precipitating factors. Say, for example, for in this case, we'll come to know if it is not continuous, what has been the problem, and what could be the reason for these problems to start with. So, do they find a reason for that? If not, then we will have to figure out over time and hypothesize, and how it has been since then, as I already told you, the course. So, all these in these kind of open-ended questions, you can elicit the emotional story, and later you come to know that she's been married since 2 years, and since then, gradually it has increased. Now the current frequency has been almost 2 to 3 worse days a week, leading on to significant quarrels in the form of talking in high tone and being argumentative with her husband. Right, she has difficulty in calming down and cannot talk to the other person as before for the next few hours. So she feels it's excessive and understands she has to change her behavior. So this is what she has told more about her marriage, and once you have asked about, can you tell more about since when it happened and all those things, you have got this information, right? So this is how you elicit emotional history in terms of using open-ended questions and non-focusing open-ended skills, and eliciting certain physical symptoms. So she has told that she's been irritable and not able to talk and all, right? And difficulty in calming down, talks in high tone, all those things, right? So now then you expand further in terms of uh, marriage, find out more about marriage, right? So you expand the cycle by talking about, she's told she's been married since 2 years, then that means, uh, how was the marriage, was it an arranged marriage, and how has been their relationship over 2 years, about their intimacy, their times together as husband and wife, good times, bad times, how would they respond when bad times happen, uh, you know how do they calm down when fights happen, what has been their usual psychological mechanisms in terms of resolving a conflict, what kind of few of them will just calm down and then take some time to come back, right? Few of them might talk it out, few of them just go to their parents and involve them to take care of all those things. So all those things about marriage you tend to explore more, right? And then she says her anger has increased gradually. You need to try to find out in what all situations those things have increased, whether it has built up over the years that the husband and wife has never come to a conflict, a resolution of conflict, and over the same problem it has widened up, whether she has started having a feeling that she's not being loved, or is there any other issues in the family, or in-laws, or with the husband itself, or how things have increased gradually, you need to understand. And why recently there has been worse days of 2 to 3 days a week, right? To finding out all those things needs to be done in detail, right? When things happen, how does she respond? She told she talks in a very high tone, isn't it? So how does she uh, behave further? Does she throw objects when anybody comes and talks to her? Does she become irritable, or she's able to regulate her mood? So all those things are very important in planning the uh, interventions or suggestions later, right? So you expand further, right? So in this way, you keep on asking few questions, and then you come, in the meantime you also understand. Step 4 will be about parallel conceptualization. In the while you do all these activities, you try to understand what kind of background she comes from, and what is the family construct in terms of their morals, their cultural background, their values uh, in terms of doing certain activities, or their own boundaries as father and mother or child. How does she behave with their parents? What are their boundaries in terms of who's the how she behaves with their mother and father? What is her character, right? How does she resolve problems? All these things you will come to know, and the context of evolution of the distress or symptoms also you come to know, and you conceptualize the case why she landed up having this problem, right? As I already mentioned in the beginning of the slides about abnormal expression of reactions or abnormal emotional reactions, depends upon the character of the individual, the way they've been born and brought up, right? And the intensity and longevity of the problem. So all these things you will try to parallelly conceptualize when you're getting these data, right? So that is what this slide talks about. So once you have done that, on further exploration, you tend to find out that she says since childhood, her likings and demands were never taken seriously, and felt that parents did not even have patience to listen to what she wants. As she grew, she was found to be argumentative, and hence parents would avoid talking sensitive issues with her. As she moved out of for higher studies from home, she felt more comfortable with her friends than her parents, but not before she faced betrayal from few of her peers as well. So, with an exception that at least her husband would be that person who would understand her better, she enters into an arranged marriage where she again finds similar outcomes. So, she feels almost that nobody understands her, and there is no one to, acknowledge her feelings. And every time she feels that she has found somebody, there is a betrayal, and there is a cycle of expectation of something, and then it's her expectation is not being met, and she doesn't understand that, when why it's happening, and then the conflict happens. It's more of an external uh, acknowledgement that she realizes than an internal acknowledgement. So where her piece revolves is about somebody acknowledging her emotions. So that is what she has landed up into, and that is the problem that she has had, right? So you explore that, and now it's time for you to parallelly conceptualize. And before you conceptualize, if you have any things that you need to finalize, I mean, get few information at the last, check accuracy of the information, right? And tell a brief summary. Once you have got any, if you have any doubts, clarify it and briefly summarize that this is what you have understood, right? And suddenly you after using all the open-ended questions, suddenly if you have any questions, closed-ended questions, to just check the accuracy of information, or a few things that you want to understand immediately, because of time constraints, you ask direct questions and say that you're doing this because because of time constraints. I've told to indicate that both style and content and style of inquiry will change if the client is ready. That means that now you will be, since it's almost at this point in time, you would have spent a lot of time with open-ended questions. Now that you want to conceptualize the case, you will have to indicate the client, now I'll be asking few questions in a directive manner, so I want you to respond in a very small short phase, or in a yes or no phase, right? And I feel that so that we'll be able to conclude the session today. Is that okay? So you can say that, and then of course they're going to be, most of them will say yes, so you go ahead with it. And then when I say disease centered part, it means like more of a closed ended questions. And so you continue until you are satisfied with the information that you've got, and then you summarize, and then now you have in your mind, you have come to a conceptualization of the case. So take a time to conceptualize this case. So how you have got a case vignette, you have a 30-year-old woman was married since 2 years, with come with anger issues, saying that gradually over time after marriage, she has had anger management problems, and she's not able to regulate her anger, which has worsened over a few months, where she's getting problems almost 2 to 3 days a week. And because of that, she's being irritable most of the time, and she's not able to calm herself down a lot of times. With the background of she being born and brought up with parents who did not have time for her emotionally, and she's always been emotionally cut down, and her emotions were never been acknowledged. And there were expectations with friends that they somehow fulfill the role of being an emotional support for her. And then there were betrayals there as well, and then she feels that at least in the long run there will be someone who's a life partner who will be able to be that person, and suddenly that also is not being met, right? And with that background, that's what we have understood, that a female was brought up since childhood with the feeling of not being understood by significant people in life, starting from parents, friends, and then husband, should feel that her voice has never been heard and her feelings were never validated or acknowledged. The frustration has built up over the years, or maybe many years to go with, and with an expectation that things would get better or change with her life partner entering her life. Since that has also led to similar events and recurrent episodes, the feeling of not being understood flares up as anger spells or outbursts. So now, in this whole assessment, you would have done a lot of open-ended skills, and in between you would have made a lot of reflective paraphrasing, right? Which we will you should go back and look at the materials that we have shared, a few videos that we have shared on how actually this client was addressed with all the basic counseling skills, only to make herself feel that there's somebody is there to, at least to hear what she says. So that itself would be a lot of therapeutic for a lot of people. That is what we call it as psychological first aid. Once you conceptualize the case, there is you can reflect it back to the client. This is what we feel is there, what do you feel? So then you give them a suggestion. Do you want to work on this feeling of not being understood? Is that really matters, or is that it feels that it's coming from outside, or is that, does that actually mean real? As now again, going back to the basic concepts of feeling, emotion, and mood, right? So once you feel mood is set in the morning, that that because of a bad emotion, that the whole mood is pervasively said that it's going to be negative. Even the good things that you see is tend, you're not going to acknowledge that, and you're going to see in the same perception that it's going to be bad. So is it that since childhood you have not seen the brighter aspect at all? Of course, would have been certain people who would have acknowledged your feelings every now and then. So can you remember anybody of them? So trying to pull them from the darker side and showing them the lighter side of the same aspect as well is what will happen as the next step, which was what we called it as, is trying to reduce the defenses and reduce the guilt and insecurities, right? Through the counseling is what we will try to do. Are they willing to focus? Are they willing to work on those skills of seeing the brighter side? If they say yes, then there is a certain way of going ahead with the intervention of stress management. If they say no, I need just direct tips or suggestions, then probably you need to go ahead with certain other ways of handling the stress or the anger. So that will, both of these ways of intervention will be discussed in stress management, right? But as of now, when I say psychological first aid, it means the assessment as a whole and trying to make them feel that there is somebody to understand in a non-judgmental manner is what we need to do. So this is the major procedure that you would do for any client who comes to you in the beginning, before giving any suggestion or even a brainstorming session at all, right? So this is the basic that you would do for anyone. Even if you don't give proper suggestions, or even if you don't intervene, it's fine. But at least this part, as a lay counselor, has to be done, and this itself is therapeutic and treatment and care. So this is what we have focused in psychological first aid. I hope people would have understood about the concepts of what feeling, emotion, and mood is all about. And once a person gets into a distress, or they start feeling or perceiving the whole world in a negative manner, and just stick on to the outcomes being always negative, and stop forgetting the positive aspects of it. And you as a counselor will understand why it happened, or in terms of their character, their longevity of this situation, and the way in which they've been born and brought up, and the intensity of the situation. You find out as a whole and conceptualize the case and tell them this is why it is. Do you want to see the other side of it? So once you do that, that itself will be a lot of relief for many of them, because making them understand that this is why it has happened itself is kind of a great exploration for them. And after that, it's about the client being readiness to work on it. So uh, so once you have done that, almost 75% of the problem is done, and the less 25 is more about stress management, which we will be focusing in the uh, upcoming videos, right? So which will be talking about direct suggestions. So that's it about psychological first aid. uh, We will see you in another video, and until then, goodbye from Dr. Rakesh.